welcome to Athletes Thriving in Perimenopause and Beyond. This is an incredible series of bringing experts together in mindset, nutrition, training, recovery. My name is Tenille. I am a coach of triathletes, cyclists, and runners, and I love to just make sure that we are incredibly rounded and taking in all the information we can so we can get through some of the challenges we have in perimenopause and in the beyond, and that we can just live life fully and with adventure, which brings me to this incredible expert that we have today, Alyssa Kuhn, who is a physiotherapist. Welcome.
Thank you. Thank you so much for having me.
I literally, when I was like, I saw your name and on my calendar, I was just like, oh, finally, to do a deep dive into arthritis. Because
Yes.
that's you are a specialist in specifically in osteoarthritis, and you live in Sandy in Utah, and you are loving adventure yourself. And so you really came to this and just like thinking, reading your bio is just like, people and clients are coming to you, they're totally frustrated, they don't know how to, they just have lost a sense of the thing that they love, which is movement and getting out there and doing the things they love and watching their loved ones go off and they're in pain. This is what I'm just like this is kind of perimenopause for many women as well. Maybe not because of the osteoarthritis, but we're going to talk about that. We're going to talk about a little bit of, how do we know the difference? Where's joint pain? Because this is something that's happening when estrogen is lowering, and when is it something that we need to seek your support and come into your world of let's keep you moving, let's keep adventurous. So am I missing things that you would like all these participants and listeners to know about you that I haven't captured?
I think you pretty much nailed it. We moved to Utah. We're actually my husband and I are from the Midwest. So I grew up in Michigan and then he grew up in Ohio.
Yeah.
I went to Ohio State for PT school, and then we moved out here about 3 years ago now, and just kind of took a leap of faith and said, we want something different. And I mean, it's been amazing. We hike, we ski, we do all the fun things, which then has kind of bled into the business and kind of how things have been created. And so it's just been kind of a crazy journey, and I'm here for it.
And here you are. And it's well, we'll get into all the ways that people can find you, and you can find it on the webpage, but let's get into, okay, osteoarthritis. We hear about rheumatoid arthritis. I hear a lot about joint pain. Can you help us untangle and get to understanding this, some of the differences? Like, how do we know, or how do we go, and when do we go to seek support?
Sure.
Yeah.
So osteoarthritis is a term that a lot of people refer to as just regular arthritis. Like say, oh, I have knee arthritis. They're likely talking about osteoarthritis. And when you look at kind of the hallmark symptoms of osteoarthritis, because unfortunately there's no test you can take, or there's no blood test or anything like that that points to saying, yes, you have osteoarthritis. It's a diagnosis of exclusion, meaning they just exclude other things first and then kind of come to a conclusion. But I think one of the most important things is osteoarthritis is not just solely based on your X-ray or MRI. So if you imagine you're having knee pain, you go see a doctor, maybe you end up seeing an orthopedic surgeon or something in that realm, a sports medicine doctor. Odds are they're going to do an MRI and X-ray. And from there, you can see some joint changes. So you can see some perhaps cartilage loss. You can see what's called joint space narrowing. So if you take the knee, for example, you have, a specific space inside the knee, and you can see that start to decrease a bit. You may see some bony edema, which is essentially just inflammation of the bone. So there's a couple of things you can look for there.
Yeah.
But there are also other symptoms that come into that, because your X-ray does not dictate your pain, and research has come to show that. And so that is probably the number one thing, I think, especially in people that are very active, are athletes, that they see this x-ray and say, you know, wow, this looks so much worse than I thought.
Yeah.
And then spiral into this, you know, I'm bone on bone,
Yeah.
XYZ surgery, etc. So it's important to also look at the other symptoms. So one of those primary symptoms is stiffness in the morning that tends to alleviate within about 30 minutes with movement. Then you also may have some ancillary symptoms like joint swelling. Pain certainly can be another symptom. So we kind of look at the whole picture here.
Mm-hmm.
Some instability. But when you're talking about rheumatoid arthritis, it's kind of a whole other animal. And oftentimes it's diagnosed a little earlier. But when it comes to, so if we look at osteoarthritis, you're typically looking at one joint. So say your right knee or your right hip. Sometimes it can move over to the other side, but usually it presents on one side. Rheumatoid arthritis tends to present on both sides. A lot of times it's in a little bit of the smaller joints, so wrist, hand, foot, although you can see symptoms in those larger joints too. But a lot of times it's, oh, you know, both my wrists are bothering me, or, you know, I'm feeling it in both of my ankles. You also may have some other systemic symptoms. So with osteoarthritis, typically you won't experience other symptoms like nausea, fatigue, maybe fever, those sorts of things. Now, of course, if pain's waking you up at night, and then that is an explained fatigue symptom. But with rheumatoid arthritis, you may have some of these other systemic symptoms. And so if you're experiencing, say, pain on both sides, and you're experiencing maybe more fatigue than usual, that's not really explained by anything else, maybe you just kind of have an overall sense of just like blah or low energy, those are some things that would point you to perhaps rheumatoid arthritis. And there is kind of one test you can take to check on that. So they'll test for something called a rheumatoid factor. So if you're starting to have kind of some of these weird symptoms along with joint pain, that could be something that you could seek out a rheumatologist. And they can kind of delve into perhaps where to go from there, because with rheumatoid arthritis, since it is a systemic autoimmune condition, there are other medications and things that you can use to help control that. Whereas osteoarthritis, you don't technically need medications. Of course, pain medication plays a part, but you can control symptoms largely by reducing inflammation, which I'm sure we will talk about in a second. But so there are some differences, but anytime you're experiencing pain, I think it's 100% worth getting checked out, because the longer you ignore it, likely the worse it's going to get.
Yeah, what it's really incredible to me is like I have this graph, and it's like looking at perimenopause, and then it looks at low energy availability, and then it looks at like these big health issues, and seeing all the places that it overlaps. And then as you were speaking, and this is where integration and knowledge, like, and trying to see what is the big picture, it's like, okay, wow, so you're feeling fatigued, you have joint pain, you know, sometimes you just feel like whatever all these the inflammatory pieces are, like, is that a perimenopause? Is that my hormones changing, or is it actually rheumatoid arthritis, or is it, you know, like, where is it? And I just want to like come to that spot that says, okay, everybody, like, this is where curiosity and like coming into communities in which you can really start diving into and saying, oh, okay, there's another thing that we can investigate. Like you mentioned, it's a process of exclusion. Excluding is a really great thing to do.
Yes,
Right?
absolutely. Absolutely.
Yeah.
And that's where it's like some of the tests for like a rheumatoid factor
Okay.
and things, especially if you're experiencing pain that doesn't seem to be responding to other things. I think the very first thing people think is rest. Something's hurting, I may need to rest it. But in an athletic population, a lot of times it's just push through it.
Yeah.
And then so you can see an increase and increase and increase. And then unfortunately, a lot of people wait until they're way up here for pain to seek help.
Yeah.
And so I think that it's important to know that with either of these diagnoses, especially osteoarthritis, it doesn't necessarily mean the end of a career or the end of an athletic, endeavors. It's important to manage it so it doesn't get to the point where those things are too far out of reach. And that's when it comes down to maybe you should go seek help before it gets way up here. And it can be hard to go seek out that help, especially when you're worried about what they're going to say. There's been extensive research on running in osteoarthritis that it doesn't make it worse. But I think one of the biggest things is you have to prepare your body in the right way to be able to tolerate that volume and that load.
Okay. So we're absolutely moving there. We're now going to so we have somebody, they're ready. They're like, okay, yeah, she's speaking my language. Like, I am ready to start moving. I've been frustrated. Just one question I have, you mentioned that so it's progressive. Like if you're not paying attention, does it get worse and worse and worse no matter what you do? Okay, you've lightened your load a little bit, but you still are kind of pushing through. If we're not aware, how does the progression of osteoarthritis occur? Is it because of load? Is it because of not movement? How does it kind of get to that point of like, oh my goodness?
So I think one thing to look at is it's not inevitable that surgery is going to be required. It's not inevitable that it's going to get worse, that you're going to have debilitating pain, difficulty moving, etc. That being said, if it goes, say, uncontrolled, so a lot of the research has come out recently that, so before the theory was osteoarthritis or just arthritis in general is from wear and tear, too much running when you were younger, et cetera, et cetera. But now research has come to find out that there's a tie with inflammation, especially kind of that low grade inflammation, which has been kind of a buzzword and, weight loss and all kinds of different things. But it really just comes down to there are a few lifestyle factors. So there are lots of things that can contribute to inflammation. Movement is certainly one of them. Too little movement or even too much movement are both going to be drivers. And those are obviously going to change depending on the person and how much load you can handle. Sleep is going to be another big one, which I'm sure that you dive into and harp on. Low sleep quality can increase pain sensitivity. Also, the foods you're eating. I'm sure, again, you harp on that a lot, but the quality of foods that you're eating can play a big role with inflammation. Those are kind of the big ones that I like to focus on, but you also have the contribution of stress to the body, increasing inflammation. So there's a lot of things that can impact inflammation, but I always say that's a good thing, because if you were in that wear and tear mentality, it basically insinuates there's nothing you can do about it. Say you don't have any cartilage, or you've lost a lot of cartilage, or you have that joint space narrowing. You see that wear and tear that basically ties it to a mechanical issue. And if it's tied to a mechanical issue, they've actually done some really interesting qualitative studies asking people about their views on surgery and their views on osteoarthritis. And a lot of people think like a car, like you have a mechanical problem that needs a mechanical solution. So replace whatever it is, and then you're good to go. The problem is if you're not addressing these inflammatory factors, getting surgery and just replacing is not going to guarantee pain relief. And so I think in my mind, it's a good thing that you have control over a large portion of these factors. Of course, genetics can play a role in a couple of other things that maybe you don't have as much control over, but a large part of it you do. And especially in an athletic population, hopefully a little bit more wellness minded, you have control over a big portion of how you feel and how this progresses, because you can reduce the progression. A lot of people can plateau their symptoms, even reduce their symptoms to the point where they don't really notice that they have osteoarthritis or any of the debilitating symptoms. So if you can control a large portion of these variables, then you can impact the progression.
This is okay. So that is so hopeful. So now, like, we are now coming into the movement. Okay. So now we know we've addressed some of the inflammation, and so your business name is Keep the Adventure Alive. And so what is it that you recommend, or what is movement? How do we manage this, intensity and variability and just movement in general? What is it? Yeah. Tell us about that.
I think one of the principles that continues to come up over and over and over again is variety, which I think is very important for your population as well. When you're in the biking, swimming, running, that's a lot of repetition in the same task. And in almost every situation, swimming's a little bit different, but in almost every situation, you're moving forwards. You're moving in one plane of motion.
Yeah.
Meaning you're missing out on kind of that lateral plane of motion, and then even that backwards plane of motion, where muscles are used in moving sideways and moving backwards. But if you don't have that inherent variety, then you get a lot of overuse injuries. You get a lot of stress to certain parts of the joint over and over and over again. Now, whether you are an athlete or you are at the very beginning stages of fitness, variety is needed. Your variety is, of course, going to look differently, whether you're doing a lot of cross training in the athletic population, of resistance training, moving in different directions, backward sled pulls, etc., or it's simply stepping sideways, stepping backwards. So they can look very different, but it comes back to that same principle. And so I always ask people to think about one question. Now, this is a little bit more on the simpler side of things, but did you move sideways or backwards today? And again, that can look very different depending on your fitness level. But even sometimes, like, even if you are, say, at a very high caliber athletic fitness level, just experiment with stepping sideways. Like if you're brushing your teeth or something, you may notice that those muscles fatigue maybe quicker than you would think. Or, I mean, walking backwards has kind of blown up with knee health, and you see a lot of, people walking backwards on treadmills and things like that. I incorporate a lot of backwards sled pulls, which is very interesting. If you have access to something like that, that can be very eye-opening as well, on how quickly those muscles can fatigue. But I think it comes down to, are you adding variety? Because if you're not, like I mentioned, you can be overloading certain parts of the joint that we're not dispersing that stress. Yeah. You can also be neglecting some of those muscles that are very, very important. Like, say, if you're experiencing back pain or hip pain or even knee pain, your hip moves in 3 directions: forward, sideways, and backwards. Primarily, you have some more accessory motion, but you need muscle support in all 3 of those directions for a healthy hip, and for, say, power and running and power and cycling and, tackling hills. And it all comes full circle back to variety. Are you challenging muscles in those different ways? And so whether you are 30 and, at that very high caliber, or you're 80 or 90, variety still is one of the main principles, and probably one of the biggest holes that I see in specifically training, for specific, especially when you get into specific sports that are very repetitive in one direction.
Yeah, like just like pedal, running, like swimming,
all on one track. Yes.
This is so brilliant. Now, just curious about this in terms of variety. So when, there's a lot of emphasis, particularly for athletes in perimenopause and beyond, strength training. Okay, so now we're doing our strength training, and we have our squat, we have our deadlift, they have push, pull, hinge, does it cover it? Or when you're talking about variety, are you also hinting at or thinking, like, sometimes we want to make sure, like, we can have the strength, but also the adaptation to varying terrain, or all of a sudden you had to, like, lunge sideways, and how do we create that? Is there thought to that, because it can be also mechanical in terms of put yourself in a laboratory setting and just make sure you do your typical strength programming.
So I think one of my biggest beefs with typical strength training, so you're talking about, squat, deadlift, even bench press, if you want to throw that in there, there is almost no emphasis on single leg strengthening. Everything you're doing is double limb.
Right.
And when you think about running and cycling, running in particular, you're essentially doing a small single leg squat over and over and over and over again.
Yep.
But then you don't train that. And so I think variety is not necessarily just, adding in these alternate directions.
Mm-hmm.
But one of the biggest things that I think people need to focus more on is single leg strengthening. And of course, there are tons of ways to do this. Lunges, of course, are going to be a popular one. Single leg squats, whether you're using a box or just like a pistol squat. There's also even like going with a single arm bench press, add in a little bit of core to that, single arm dumbbell overhead press. Those are, of course, moving into the upper body, but there are so many ways that you can incorporate single leg strengthening that I think a lot of people miss out on. So personally, I used to do a lot of CrossFit, which they have a lot of variety there. But when you think about it, a lot of it's double limb. You're almost exclusively doing no single leg or even single arm movements. And so I actually started programming for my husband and I to add in more variety. We're doing more weighted lunges. We're doing more, say, like single leg deadlifts. We're doing more backward sled pulls, kind of lateral lunge type things, to really kind of feed and fill the gap. So especially if you are one of those people that maybe always seems to be injured, always seems to be in pain, there likely is a gap in your training, something you are missing that can fill the gap or maybe strengthen the imbalances or the compensations that you've started to develop or have come up over time. So I think one of the biggest things when you're looking at adding variety to your training, it's, are you moving in different directions, and are you challenging one leg and the other basically separately to see if there's a difference? A lot of people have, say, right leg stronger than left, or there's a clear difference between the two. One other thing I want to touch on that is balance. And I think when you add in the variety of the moving in different directions, different terrains, etc., you start to challenge balance. Now, when you are younger, healthier, you're doing these higher caliber fitness activities, you think, oh, I can stand on one foot, my balance is great. Well, there are much higher level balance things that may be very humbling. And for your audience, I would encourage you to safely try this balance movement. So if you grab a kettlebell or a heavier dumbbell, I'm talking like 10 to 20 pounds. Stand on one foot and then simply pass the dumbbell back and forth. Now, of course, the heavier you go, the harder this will be. But this is going to displace your weight laterally and challenge your lateral stability, which a lot of times we do not do. And I had one client who got up to the point where he could do a 25-pound kettlebell back and forth, which if you try this, you will appreciate how humbling this movement is. And so you start to get into that higher level balance, which again, a lot of people are missing. Weighted single leg deadlifts are another way to kind of challenge this as well. But that can be another piece of variety that you can really start to open the doors to challenging muscles in different ways. So I think the big thing about variety is just opening your eyes to, wow, I've been doing the same thing over and over and over again, which a lot of people, when they're doing strength programs and following certain things, can fall into the trap of doing the same thing over and over and over again. Certainly there's a place for squats, deadlifts, etc. But you also have to look at, are you getting enough variety?
That's a great reminder. When you mentioned that, rheumatoid arthritis is often in both joints, but osteoarthritis can be in one joint more. Do you look for, maybe it occurs that because of the pain that one is feeling in their knee or wherever it might be, that they are really favoring the other side. So how does symmetry come into it, and the awareness of symmetry come in?
Asymmetry is probably one of the largest irritants when it comes to osteoarthritis, especially when you're in a high volume sport or a high volume activity, that you're feeding into these compensations, and they're not always super apparent. They could be very subtle things, but when you start to add volume to that, it amplifies it. So symmetry, now, of course, it's not going to be perfect, but symmetry is so incredibly important. And that's why one of the tests that I primarily use just to test kind of the glaring symmetry between two sides is a single leg chair squat. Now, of course, if you're at the lower end of the fitness level, it's a modified chair stand where one leg is extended but on the floor and the other leg is back bent, ready to stand up and down. So whatever kind of variation you can handle with a single leg squat, that is, I would say, do 10 each side and see how it feels. Do you lose control on one side? Say a lot of times you have a lateral translation with the knee. So the knee kind of wobbles or the knee moves side to side as you're standing up and down. Or it's just, it causes pain, or it's just hard. Maybe you lose your balance, or there are some things that you may be able to point out in just that specific movement, saying, oh, I haven't done this in a really long time. This is much harder than I thought. Then, of course, you can add speed to it. So if you can see how many see how long it takes you to do 5 single leg chair stands. And of course, you're now adding speed, which challenges single leg power, which is strength plus speed. So it's one thing to be able to do 10 chair stands at a leisurely pace. But if you add speed to that, see how your form changes. And I always encourage people to do this specific movement in front of a mirror, because sometimes you may not be able to see or feel maybe the instability at the knee, or maybe your foot turns out and you might not feel that. So that's also something that you can test, that, wow, when I add speed to that, it becomes a lot harder to control. Now think about running. Running is adding speed, and you also need strength. So you need power for running. If you fall apart with 5 single leg chair stands or 5 single leg squats, think about what that's doing to your running. So I would say probably one of the baseline tests would just be to experiment with that. Now, of course, if that feels easy, you may need something that's higher level to pull out those muscle imbalances. But I think one of the biggest things to test for that symmetry is just looking at that single leg strength.
Oh, so incredible. Yeah. This is where just constant intention, like understanding, like when we think about strength programming, and so this would be for somebody who isn't at risk of or doesn't have, and I guess this would lead to another question of mine, is like, is there a prevention? There's a prevention component here that we may not know that we are on, or, we have a smaller gap, or our gap is, lessening and lessening, our cartilage is starting to, get thinner and thinner. We may not know that yet, but doing this work, it's not just when we get, like, you're working with people that are just like, oh my goodness, but you could also technically work with people that are just like, I would like to prevent this, or get to a point that it's not so bad. And so as a coach that, works with strength programmers, is identifying, okay, these things are principles that we should have anyway.
And that's the thing, is these principles are not just for these principles have changed the way I train. And now both me and my husband honestly have not been injured or have had pain as much as before, when we were following, not to any means bash on CrossFit or anything like that. But when you get into this comfort level of avoiding this variety, or not even purposely avoiding it, just not getting enough. Like if you think about it, when's the last time you did a heavy lunge? Or when's the last time you did a single leg deadlift? Or when's the last time that you did anything that was, say, an overhead press with, or a single arm bench press? And if the answer is, oh, you know what, it's been a while, or again, if you start to notice that you are injured more, or you just have these nagging injuries that keep reoccurring, again, it could be a gap in that training. So regardless if you have pain or not, adding variety is going to help to prevent that. Now, of course, you can't prevent all pain, so you may still, this is not the foolproof way, but it certainly can make you more resilient as far as coming out of that and figuring out maybe why, okay, I've been having this recurring right shoulder pain. Well, think about your training. Are you doing a lot of barbell bench press? Are you doing a lot of barbell overhead press? Not that those movements are inherently bad, but your shoulders are locked in a position and there is not a lot of variety for your joints to move, which is why adding in some dumbbell training can be very helpful for that. So it really just comes down to making sure your joints are strong and stable to not only help to relieve pain if you have it, but to prevent it, or to make your body more resilient to bounce back. Because I assume a lot of athletes want to be resilient. They don't want to spend a lot of time in pain. They don't want to spend a lot of time in the recovering from pain or recovering from an injury. You want to be able to bounce back rather quickly. So, I mean, this is, and I don't particularly have joint pain, but this has changed the way that we train and has just been able to help carry over into just overall joint pain and reducing injury. So 100% do not just follow this when you have osteoarthritis or when you start to experience joint pain. This is across the entire spectrum, no matter how old you are, no matter what your fitness level is. This is absolutely something that is necessary.
Amen. Takes a lot of intention. No, I think that what you're doing, and I think it's really important, is like, I'm thinking of the athlete that's listening, and again, like just thinking, okay, so this is another thing I need to think about. The thing that I want athletes to come away with this is find people that have really sought out the breadth of technology. I'm going to use the word technology, not in a sense of like an app, but the technology of our bodies and the intricacy and the interconnectedness. So you have talked about sleep. You've talked about nutrition. You've talked about, movement. You've talked about variety. There are so many components that you said, this is how we have healthy joints. This is how we keep moving. This is how we continue to have adventure. And it's when we start to come into a singular method that I think that we run into a bit of trouble. And so what I want to encourage people to, take away and to listen for, or to see and to evaluate is like, okay, in my current training, you've said it, is like evaluate and understand the intention. Am I always doing this movement? How am I cross-training? How am I having variability and variety? I'm so glad, like the things that I know my strength coach is really attuned to this, right? They're attuned to the variety. They're attuned to understanding how the core works, not just in a plank, right? And not just hold or isometric or getting, it's like Turkish get-ups, and like I hate those things and they're hard. And you know what I mean? And I had to like go through slow-mo, like how many times did I have to do it, because they're really challenging so many different components of stability and upper head and the single leg and all those components. And where are those things? And I think what I really want to come back to is now tell us a little bit about what you do in the adventure part. So keep the adventure alive. So just, I think for people are just like, okay, so what is it the strength programming? Is it the variety of movements that you're providing? What is it that you do specifically to get them out into the world and play?
Yes. And honestly, I think One of the biggest factors that people lose when they're in pain, lose to the traditional healthcare system and how they typically handle the osteoarthritis realm of things, is confidence. I feel like so say right in the beginning, we were talking, you're experiencing knee pain, you go see an orthopedic doctor, or you see a sports medicine doctor, whatever it is. Again, this is not saying all doctors are bad and they just want to see you fail. But a lot of people are doing this without even realizing. But when you start to bring in the heavy hitters, like damaged, your joint is damaged, your cartilage is gone, your joint is deteriorating, you have the joint of an 80 or 90-year-old, a lot of these factors can really start to hinder what, like the mobility that you're willing to do. You start to lessen the new things that you're willing to try. And a lot of times people become literally fearful of movement, fearful of doing certain things. And it really comes down to figuring out how to rebuild that confidence. Now, osteoarthritis is being diagnosed younger and younger, which I think is honestly a good thing, because a large portion of people likely will develop symptoms, but again, won't go see help until they're way up here as far as pain is concerned. So I honestly like that it's diagnosed at a younger age as we learn more about it, because then you can start to develop habits, because pain, unfortunately, makes you want to take action and find something. So it's like, oh, I have knee pain. How can I handle this? How can I prevent this or deal with this 20, 30, 40 years down the line? And so when it really comes down to rebuilding that confidence, it's okay, I am essentially giving you permission to move, which a lot of people need, but they don't really realize. So we're breaking down this fear of movement. So movement, as a physical therapist, movement is one of the primary factors that I address. In terms of, say, people that are having a hard time walking, people that are having a hard time doing stairs, people are having a hard time running, etc., figuring out ways to rebuild the body using the principles that we just talked about. Variety is one of them. Managing volume is another. A lot of times it's getting people to move and become more consistent with movement again.
Yeah.
So alongside those factors, we've essentially built a system that brings people in. I get a lot of people on the end of the spectrum where I've been dealing with pain for 10 years. I have pretty high pain. I need to figure this out. I need to get stronger. I am not able to walk the distance I need to. I'm not able to do stairs. How can I do this? So people come in, and then we have a system that has strategically designed workouts after dealing with thousands and treating thousands of patients with osteoarthritis, and then have specific tests that people must pass in order to move on. And you best believe balance is a big part of that. Single leg strength is a big part of that, to start to fill in some of those gaps. Because you look at, workout libraries, not to bash or say any of these programs are bad, but you look at like a Silver Sneakers, or you look at something that is inherently viewed as, okay, this is for people that have osteoarthritis, this is for older people, when in reality there's not necessarily a specific progression. Yeah, maybe you go to a balance class, maybe you go to a strength class, whatever it may be. There's not a specific progression of, okay, this is the goal that we're working towards. It's kind of this random. And even the people my age that are training, it's kind of the same thing. You're not necessarily working towards a goal, but you're just kind of in this state of doing random things. Yeah. So here you have specific goals to pass in order to get to walking, in order to get to even standing for longer periods of time, getting into that higher level strength, and then getting up and down from the floor. One of the levels in our membership specifically works on kneeling, getting up from the floor, and stairs, all of which you need single leg strength and power. When you don't see a lot of single leg strength and power in these workout programs that say are just stereotypically viewed for older people, people are capable of so much more than they give themselves credit for. That age certainly doesn't dictate what you're able to do. That osteoarthritis certainly does not dictate what you're able to do. But in order to realize that, you need the right steps to get there.
Yeah.
If I were just to send you off and you have knee arthritis, send you off with, doing 15 squats a day helped your friend. So you try that, but then squats hurt. So it's like, oh, well, I don't think I'm ever going to be able to squat again, or exercise just isn't for me. It becomes this generalization. But if I set you up with, okay, let's try this modification of a squat, or let's try this motion to master before going to a squat, it's set up in a way where you're seeing yourself make small wins and say, I can do this, instead of, oh, this is just another thing that I cannot do. So that was a long-winded answer to say we have a membership that brings people through
A system.
to build strength, to build
Yes.
balance. And it's basically built for, you take a test when you come in, basically built for people who are at the beginning stages. I have a hard time standing for 5 minutes, or to the people that I have problems with stairs. I just want to build strength. I want to get back to pickleball, et cetera, et cetera.
Yeah. I have a quote. So I have a system too, like I call it the MNTR, Mindset, Nutrition, Training, Recovery, Integrated Training System. And so when you're speaking to your system, I'm just cheering, because one of the quotes that I live by is, you don't rise to the level of your goals, you fall to the level of your systems, by James Clear. And what you're speaking to is like, we can have these goals. So you want to walk upstairs. So you have our osteoarthritis. It's clear. You want to walk up the stairs. And so you start your strength program because that's what you're supposed to do. But what I hear you saying, and I just so fundamentally believe in it, is that like, there's a system in place that can build the confidence, that builds the progression safely, that builds all the pieces. And yeah, it's progression. It's slow. That's how it works. That's just how it works. And it's beautiful. And I just, I'm excited for people that didn't know all these things and that can seek you out. So, you have a free gift. You have
I
a free
do.
gift, and it's called Jumpstart Your Arthritis Adventure Challenge.
Yes.
So tell us about that. Yeah.
Yes. So it's essentially 4 follow along workouts with me to really understand not only the movements. Now, I will caveat this with that the movements are fairly lower level, more tailored towards people who are in the beginning stages of their fitness journey. But I also caveat this with, sometimes it is very important, almost all the time, to go back to the basics.
The fundamentals, people.
Yes, because so many people are humbled by this, or many people realize that they've started to develop these imbalances and these compensations that they didn't realize before. Yeah. So sometimes even going back to, say, easier workouts or going back to those basics can be very eye-opening. And essentially what this does is not only shows the movements and brings and opens your mind to what you're able to do, but it also kind of branches and bridges into some of the fundamentals that we practice by, that I create all of my videos on. Again, hinging towards that confidence piece, bringing people hope, because that's one of my biggest missions, is to bring hope to people that have osteoarthritis, that no, it's not the end of the world, that no, you're not going to inevitably need a joint replacement, although surgery does actually have its time and place. But it's taking the fear out of it and really starting to build these habits. And so in these 4 workouts, you're going to start to build those habits to the point where you can say, I want you to end that 4-day challenge and say, wow, you know what? I can actually do this. I can get stronger. I can move and not be in pain. Mm-hmm. And it's really breaking down those barriers to then open the doors to the membership, where you can then get on that path. Yeah. So it would be great, again, no matter what age you are, no matter what fitness level, it would be interesting to kind of humble yourself and to see how that 4-day challenge goes for you.
Oh my goodness, I cannot say enough about that, because like, as a professional, when I was a professional triathlete winning, 70.3s, had I had the wisdom that I now have and hear you speaking to, of get back to the basics, I could have stayed there. but my basics, my fundamentals were breaking down. The core of, we talk about building a house. If your foundation is cracking,
Exactly.
it doesn't matter how fit you are, you're going to crack. Like,
Well, and it's
yeah,
the, do you have holes in your
yeah,
training? Like a lot of times just because you're very fit does not mean that you are oh, what's the word I'm looking for?
resilient.
Yes, or invincible against
Yeah,
injury.
yeah.
And so if you have an injury or if you're experiencing pain, that is your body communicating with you to say, okay, we need to change something.
Something.
There's something that's irritating the body. There's something that's just not right. That this is your signal that unfortunately a lot of people ignore.
Yeah.
And so a lot of times when you have those signals, it's okay, let's go back to the basics and we need to find out where those muscle imbalances are or where those asymmetries are. And a lot of times you can point those out by going back to the basics.
That's so great. Okay. Sold. Yes, let's all do it. Everybody, come on.
Yes.
Let's get her
Yes.
done. We're all going to, whether we think we have osteoarthritis, we're all going to go.
Exactly.
I
Or
love
like
it.
if
Yeah.
parents or friends
Yes.
or family that you know that are dealing with joint pain or
Challenged.
dealing with, whether
Do
they're
it with
diagnosed with
them.
arthritis or not. Yeah.
Yeah. Get going. Do it with them, and share widely, please. So I'm going to go to my rapid fire questions for you. Is there anything before I go to those questions? Is there anything that I think we've covered a lot? Is there anything that you wanted to say that I haven't asked you about that you kind of were just like, oh, I could have said this?
I really think it's just changing the perspective, looking at the way that you look at your training in particular, and the way that you look at, say, your recovery, and just opening your mind to some of the other factors. I think, like, when it comes to pain, a lot of times movement is blamed. Oh, I must have done something, or oh, I must have moved wrong, or oh, I must have done that. But there are other factors that do come into and contribute to pain and inflammation. So it's really just kind of looking at that global picture that I know that you continue to promote.
Yeah.
But it's also looking at your movement quality and just reflecting on, okay, I am in pain somewhere. That's my body telling me something. Okay, what is it telling me? What do I need to change? And then kind of going in on a journey to find that.
Curiosity. It's the key word.
Exactly.
All right. Perfect. What are you thankful for? Here's a rapid fire. Okay, everybody, this is a rapid fire. I'm asking every single expert and speaker that is coming into the series the same questions. What are you thankful for right now?
I'm thankful for this opportunity to be able to help all sorts of people that honestly social media has really granted. We've been able to reach so many people. And I think one of the biggest things that has been kind of a pivotal moment in all of this is the support of my husband now, who's been nothing but supportive along this journey and has truly been able to help us really. I mean, we are reaching so many people that is just beyond my wildest dreams. So it has been an amazing journey, and I'm just thankful for that.
Oh, so cool. Yeah. Well, you can just hear it in the passion that you have and the clarity that you have. So I really appreciate that. What is one thing that you struggled with or learned recently that you wish darn it, I wish I knew that 10 years ago.
I think it's everything is a test. And that is attuned to business. I mean, not everything's going to go your way. Starting a business and being an entrepreneur, that could have saved a lot of, I know it's not always easy to realize that, but a lot of stress and things came from that everything is a test, that it's okay to fail. And also, I mean, in training and things, that not everything is going to go perfectly, and it's what can you essentially learn from this. Everything is a learning opportunity, and I always like to view pain as a learning opportunity as well. It's your body kind of communicating something, and what can you learn from that? Oh, I did too much, or oh, that's too much for me right now, or that caused a lot of stress. So it's really taking these learning opportunities and viewing everything as a test instead of viewing everything as just being personal, or everything being it has to be perfect.
Yeah. Growth mindset. It's a beautiful thing.
Exactly.
Yeah. What is a quote or a saying or a phrase or something that just you kind of like keep coming back to and that you live by, that just inspires you to, get going, keep going?
Yes. So I think that one of the mantras that I've lived, and I'm actually staring at the sticky note right now, that I have on my computer, is it's about the transformation, not the information. And I think that's what
Amen.
really, I mean, it can be applicable to business, it can be applicable just to life in general. But I think a lot of people lose sight of where they started and how far they've come instead, and just focus on the information or just focus on the black and white, like, oh, I still can't do that, but look how far you've come in that meantime. And in business, it's the same thing. We're pushing people for a transformation and not just focusing on the education. Anybody can do that. You can go online and find something, but it's just how you pull out that transformation, how you pull out that confidence, how you pull out those things outside of the black and white that really can continue to motivate you and continue to, set fire to your journey.
Mhm. I think what you're touching on is, and it's so critical. Within the summit, you're going to get a lot of information. And what you're speaking to is so incredibly important. It's like, what do we do with this information? What is it that's going to
Certainly.
really touch our hearts and actually allow us to, you're building awareness through information. You're building us like aha moments. We're building connection to, people. We're building. So in my framework, it's awareness, connection, and then take action. And it's in the taking action that we're going to find transformation. And that is not a straight line,
Yes.
but that's where that's the gold. That's the
Yes.
gold. So I just want to say, like, I appreciate you so much. I appreciate this conversation. I appreciate the education. I think we've all learned a lot. And I just love it how I can see how things that, we do, just like, yes, that makes sense. That's why. It's like all these things. It's like, this is another thing that I think that I can improve, but also that I have, like, it's just really cool. It's cool to acknowledge it. So thank you for coming on and sharing your brilliance.
Yes, absolutely. Thank you so much for having me on.